Hello, I'm Richard Stewart. Welcome to Cleveland Health on TV 20. This is the show where we tackle the health issues that matter most to our neighborhoods. Each week, we bring you powerful stories, expert insights, and real resources to help you and your family live healthier, stronger lives. Thank you for tuning in. Now, let's dive in to what's shaping the health of Cleveland today and try to make a difference together. Today, we're spotlighting several powerful stories impacting Cleveland residents. In honor of World Blood Donor Day, we spoke with Christy Peters at the American Red Cross about the life-saving importance of blood donation. We also visited Cleveland Metro Health's Bone Marrow and Transplant Unit, where Dr. William C. shared promising advancements in transplantation and what they mean for patient outcomes. But first, we take you to Fairview Hospital, where Dr. Robert Abusali from the Cleveland Clinic's Urology and Kidney Institute walks us through the importance of early detection in fighting prostate cancer. You'll also hear from a cancer survivor and former NFL player Chris Scott, who opens up about his diagnosis and why he believes that no one should go through a health journey alone. Prostate cancer is the second most common cancer in American men, and while the diagnosis can be terrifying, advances in technology and treatment are giving patients new hope. Here at the Cleveland Clinic, doctors are combining cutting-edge technology with compassionate care to tackle prostate cancer. And for one local man, that innovation made all the difference between fear and survival.
Man, it felt like a death sentence.
Chris Scott, a former professional athlete, was blindsided by his diagnosis.
Once I had that health evaluation, they detected something was wrong with my PSA was kind of high. So they were really concerned about that. So Cleveland Clinic made an appointment for me to see a urologist.
This is a huge event in their lives, and it's very difficult. They're often overwhelmed. The nice thing about the urologic cancers is most of them are curable, so that's very satisfying for both the surgeon as well as the patient. One thing that we've always done at the Cleveland Clinic is innovate with respect to surgery, so using new technologies, robotic technologies, minimally invasive technologies to approach urologic cancers.
She told me that I had cancer in all 12 of my prostate. I said, oh, wow.
After weighing options like radiation and active surveillance, Chris underwent robotic surgery.
We ended up doing a robotic prostatectomy. It went very well, and he recovered fairly quickly and has had an excellent outcome.
The mental toughness has always been a part of, my life. You can't be prideful. You got to be vulnerable. I think a lot of times men is, things what men don't talk about is emotion or vulnerability. If you're gonna walk the walk, you gotta talk the talk. And that's what helped me. So what I do now, I teach a chair exercise with senior citizens and to be mobile, be more mobile.
We're back here at the studios of TV 20. Several HIV/AIDS awareness initiatives are held during the month of June, including HIV Long-Term Survivors Awareness Day, held on June 5th, as well as National HIV Testing Day on June 27th. Joining us to discuss this is Rebecca Sabala. She's Associate Executive Director of the AIDS Task Force of Greater Cleveland. Thank you for joining us.
Thank you for having me, Richard.
So, what's so important about June when it comes to AIDS/HIV awareness?
I don't know that there's anything in particular other than the first noted accounts of what would become known as AIDS were discovered and published by the CDC on June 5th of 1981.
We've come a long way since then.
We have. It's been a little over 40 years, and it's still an epidemic, and we are still in the fight.
How has the conversation evolved in light of improved treatments and just the length of time that's passed since this disease first became known to Americans?
I find it fascinating because I've only been in this work for a little over 15 years, and even in that short amount of time, we have seen medication treatments go from 3 pills a day to 1 pill a day, and now we're looking at long-term injectables. So that's a very short time span for such technology to take hold and make its way to the public.
Talk about the education and outreach programs that the AIDS Task Force of Greater Cleveland employs to reach young people and city residents in general.
We are very, very lucky to be blessed with very forward-thinking, innovative leadership. We try to, it is our ultimate goal to reach people where they're at. So if the youth are on TikTok, we're on TikTok talking to them. If when they were on Facebook, and even, I'm gonna date myself here, back in MySpace days, we would be on Facebook and MySpace. We're still on Facebook. But we try and be in youthful spaces. We try to be cognizant of who we hire to make those outreach efforts. So we're very thoughtful about that.
What type of community partnerships do you employ to kind of be a force multiplier in your messaging?
We try to partner with as many government entities, community organizations, hospital systems as we possibly can. We have a great relationship with the Greater Cleveland Food Bank. We do a lot with the LGBTQ community center. We do a lot with mental health. We do a lot with housing. We do a lot with substance use. So we try and get in deep with community to wherever the people are.
For those who want to get involved and support your mission, what are some of the options for people to insert themselves in this fight?
Oh, please give us a call. We'd love to talk to you. Come to one of our events. Join us for the conversation on social media. We love when people ask questions. So yeah, please join us wherever you see us.
Rebecca, thank you for visiting the studio and joining us to share this important information today.
Thank you for having me.
Coming up next, Christy Peters from the American Red Cross joins us in the TV20 studio to share the importance of blood donation and how you can help save lives. And later, the Cleveland Department of Public Health partners with Urban One Radio in a powerful effort to fight childhood lead poisoning. All that and more right after the break.
Today's vote, in my eyes, is not a very difficult one.
Hello, I'm Scott Osicki, Chief Executive Officer of the Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County. We know that life can be overwhelming, but you don't have to face it alone. If you or someone you know is feeling anxious, depressed, in a mental health crisis, have alcohol or other drug use concerns, or just need someone to talk to, help is available. Call or text 988, the Suicide and Crisis Lifeline. It's free, confidential, and available every day 24/7. Trained and caring counselors are there to listen, support, and help you find hope no matter what you're going through. Remember, you're not alone. Call or text 988 anytime because your mental health matters, and so do you.
Hello, I'm Michelle Princeton, and I'm a licensed social worker working for the Social Support Service Unit out of the Mayor's Office of Prevention Intervention Opportunities for Youth and Young Adults. The City of Cleveland has demonstrated a long-term commitment to residents working to create safe spaces in our neighborhood resource and recreation centers where families can access free resources and support services. We are committed to working together with families and other community providers to identify and help families who are struggling to achieve a better quality of life. To access the social support services, leave a message at 216-664-2223 and a team member will return your call. Our work includes referring individuals to appropriate services such as medical, hospital-related, long-term counseling, public assistance, veterans benefits, Social Security, Medicare, Medicaid, food stamps, housing assistance, Head Start, and student loans. We also provide support and guidance for youth and young adults in addressing stigmatization, scapegoating, labeling, bullying, substance abuse, and unhealthy relationships. Once again, to access social support services, leave a message at 216-664-2223, and a team member will return your call. Thank you.
Welcome back to TV20's Cleveland Health. I'm Richard Stewart. Thank you for staying with us. Today, in recognition of World Blood Donor Day, we're highlighting the importance of giving the gift of life through blood donation. Joining us now is Christy Peters. She's Regional Communications Director for the American Red Cross. Christy, thank you for joining us.
Thank you so much for having me.
Let's talk about World Blood Donation Day. Why is it so important to the Red Cross, and what's your message today?
World Blood Donor Day is important because it gives us a chance to recognize the millions of volunteers across the world who give blood on a regular basis. It also allows us to raise awareness about the ongoing need for blood that can only be met when volunteers step forward and give.
What's the real practical impact of blood donation, and how does it affect our local community, including our hospital systems?
The American Red Cross supplies about 40% of the nation's blood, and that means ensuring that all local hospitals across the country have the blood they need. Here locally, we have several large hospital systems that depend on blood products to help in emergencies, as well as for patients that are going through different treatments, such as cancer, or who are fighting diseases like sickle cell disease.
So who's eligible to donate blood? Are there any requirements? And what would you tell someone who, for example, was a bit apprehensive about doing it for the first time?
You have to be at least 17 years old. Here in Ohio, you can be 16 with parental consent. We just ask that you feel well on the day of your donation and bring a photo ID with you when you come to give. There is no upper age limit to donate, and many people are concerned about perhaps medications they've taken or places they've traveled. We encourage you to visit our website, which is redcrossblood.org, to answer some of those questions. If you've never given before or it's been a really long time, I would encourage you to think about the patient who needs that blood, the person in the hospital that's depending on your gift to overcome the situation they're facing. Despite the medical advancements we've made, there is no way to get blood except through volunteer donors.
So given natural disasters, emergencies, the pandemic, other unforeseen events, has the demand for blood changed over the years?
We definitely see times during the year when blood demand goes up and maybe goes down, but hurricane season just started on June 1st, and obviously here in Ohio we don't think about that a lot, but when a disaster hits in Texas or goes across Florida up into the Carolinas, that means those areas aren't able to collect blood. And because we are a national system, we do have the ability to move blood wherever it's needed. So people here in Northern Ohio have the ability not only to help their neighbors, but to help people across the country who might be impacted by a natural disaster.
What steps does the Red Cross take to ensure safety both for patients and for donors?
When you come to donate blood, we're going to check your blood pressure, we're going to check your temperature, we're going to check your iron level and make sure that you're feeling well. Your blood donation is also going to go through different tests before it's sent out to a hospital. It's actually about a 3-day process from the time someone gives blood until that blood is ready for a hospital patient. Our goal is, of course, the safest blood supply possible, and of course, the safety of the donor and the patient.
So how do you get involved, whether you're a school, a community group, an office cohort? How can the average group help?
We're always looking for more people to open their doors and host blood drives. Obviously, if we don't have a place to hold a blood drive, we can't do that. So you can find out more at redcrossblood.org or at 1-800-RED-CROSS.
What are some common misconceptions about donating blood that you'd like to dispel while you have the floor?
I think the biggest one is that it's going to hurt. It really is something that we build up in our minds. It's not as bad as you think. The American Red Cross staff are absolutely fantastic and will walk you through the process. Also, there is not an unending supply of blood. It's not just there whenever we need it. We need the community to help meet that need and keep our shelves stocked.
What about donor diversity? Is that a thing? And if so, what's the Red Cross doing to ensure that they're getting a diverse group of donors and able to service a diverse group of potential patients?
Donor diversity is absolutely a thing, and it's very important. It actually makes a difference for patients when they get blood from the same ethnic and background as the person as they are. It can lead to less transfusion reactions, and many of the population, such as Hispanics and African Americans, have a higher percentage of type O negative, which is the universal type, and is always in demand. So that's why we encourage all diversity, everybody to come and give, because really you are a unique match for a patient in need.
Christy, thank you so much for joining us and sharing such valuable information about blood donation.
Thank you for having me.
Next, we visited Metro Health's Bone Marrow and Transplant Unit and spoke with Dr. William See., Chief of the Division of Hematology and Oncology. You'll also hear from Dottie Ramirez, who shared her very poignant story with us. Once considered out of reach for many patients, bone marrow transplants today are more accessible than ever thanks to medical advances and donor registries. And for one local woman, that meant the difference between life and death.
I think it's a blessing that we're able to get this done, you know, because if it was maybe 20 years ago, you know, I would have been a goner.
Dottie Ramirez was diagnosed with blood cancer and soon afterwards became a candidate for a bone marrow transplant.
Bone marrow transplantation is a medical treatment approach for many types of cancer. Currently, the most important bone marrow transplantation indication is for leukemia, myeloma, and lymphoma. And we used the chemotherapy to put the patient's disease under excellent control. Then we can introduce the donor's stem cell into patient's body and utilize the donor's stem cells to eradicate whatever leftover disease.
My emotions were up and down. I was a little scared, but after meeting all the people, you know, and them explaining to me all the procedures, and I felt better.
Dottie's transplant surgery was made possible by advances in donor matching, once a major barrier for patients of color and mixed heritage. When most people hear bone marrow transplant, they think donor. But for some patients, the best donor is actually themselves. It's called an autologous transplant, where doctors collect and reinfuse a patient's own healthy stem cells to fight disease. It's a high-stakes, high-reward treatment that's offering new hope for remission, and in Dottie's case, a cure.
We used to have the donor and the patient match need to be perfect or near perfect. But now, because of the advancement of transplant biology, we can actually choose the donor even half match with the recipients. That making most of our patients can overcome the donor matching barrier and making almost every patient had a chance to get the donors. Unlike organ donations, which usually happened after a death event. But the stem cell donation is done by healthy donor, and it just involves a very short period of recovering time.
What does it mean to me? It means everything to me. It means another opportunity to get things right with the whole world, with myself, with, you know, everybody.
The World Donor Days holds a significant meaning for any transplant program across the world. It is not just a date on the calendar, it reflects the generosity of a human spirits that make life-saving treatment possible.
I want to, you know, just be a better person, be a better whatever, live my life to the fullest.
For more information about Metro Health's Bone Marrow and Transplant Unit, you can visit metrohealth.org/cancer. We'll be right back after these messages.
In an instant, everything can change. I know this pain. My name is Nicole Ward. I am the co-founder and executive director of the Make Them Know Your Name Foundation. I lost my husband, Paul, to sudden cardiac arrest. It happens far too often and without warning to anyone at any age at any time. But here's the truth. You have the power to save a life. A few seconds, a few simple steps. That's all it takes to turn tragedy into survival. Be the reason someone gets a second chance at life. Learn CPR. Know how to use an AED. When the moment comes, will you be ready? Step up, take action, and make them know your name. Visit mtkyn.org today.
At Cleveland Rape Crisis Center, we believe that everyone deserves to feel safe, supported, and heard. For over 50 years, we have been here to help survivors of rape, sexual abuse, and human trafficking rebuild their lives and to prevent future violence through education and advocacy. Our services are confidential and always free of charge. We provide 24/7 crisis and support hotline for immediate help, individual and group counseling to promote healing, specialized services for children and families, advocacy and legal support to navigate complex systems, prevention education to empower communities, resources and support for deaf and hard of hearing survivors through our Deaf Pathways program, and drop-in center for the on-spot assistance. No matter what you're going through, you are not alone. Call our 24/7 hotline at 216-619-6192 or text 216-619-6192 or visit clevelandrapecrisis.org to chat with a trained professional. Help is here and healing is possible. Together, we can make a difference.
Welcome back to TV20's Cleveland Health. I'm your host, Richard Stewart. Now, let's take a look at an important initiative that helps combat childhood lead poisoning. Earlier this month, Cleveland's youngest stars dressed to impress for the Tiny Tux and Tiaras Kiddie Prom at the Frederick Douglass Recreation Center. Kids from pre-K to 5th grade showed up in tuxedos and tiaras, dancing the afternoon away under a glowing disco ball. Hosted by Urban One and the Cleveland Department of Public Health, the event mixed fun with purpose, offering free lead screenings and health education for families. With photo booths, music, and big-ticket giveaways like PS5s, bikes, and $1,000 gift cards, it was more than just a party. It was a celebration of health, joy, and community. Tiny Tux and Tiaras proves that when you meet families where they are, magic happens.
The way you turn Kiddie Prom with lead poisoning is you meeting the people where they are at. We know that if you bring up an event where it's engaging for kids, it's fun, food, now you have an opportunity to talk to the parents, talk to the guardians, so they can get resources about something that is going on. So this is the opportunity to say, we got our kids here, why don't we make sure we give the parents the tools and the resources necessary to address lead?
When they pitched this idea, Tiny Tuxes and Tiaras, it went right over my head, and didn't know sort of what kind of turnout we'd have, but looking around, being here today, this is incredible. I'm so proud.
Let's talk about some other health topics that could impact you or your community on this month's Statistics segment. This June, in recognition of Alzheimer's and Brain Awareness Month, the Alzheimer's Association is encouraging all Americans to take proactive steps toward better brain health. The association reports that today, more than 7 million Americans aged 65 and older are living with Alzheimer's disease, a number that continues to grow. Incorporate healthy habits that may reduce the risk of cognitive decline. Learn the early warning signs of Alzheimer's and other dementia. June is also National Post-Traumatic Stress Disorder Awareness Month. The disorder, known as PTSD, develops after you go through or see a life-threatening event. Symptoms can include flashbacks, difficulty experiencing positive emotions, feelings of numbness or detachment, or irritability and outbursts. Talk to a doctor or mental health care provider if your symptoms last longer than a month or disrupt your daily life. This month, you can also celebrate Family Health and Fitness Day, a nationwide initiative led by the National Recreation and Park Association. The day highlights the vital role parks play in recreation and keeping communities healthy and active. Local park and recreation agencies are encouraged to take part by inviting families to get moving and prioritize wellness at their neighborhood parks or recreation centers. That concludes this edition of Cleveland Health on TV 20. Thanks for watching. We hope you learned something that could help you or a loved one live a healthier life. If you're interested in having your health journey featured on TV 20, you can email us at tv20@clevelandohio.gov. I'm your host, Richard Stewart. Thank you for joining us.